Ready? Okay. Good morning, everyone. Welcome to the Maricopa Regional Continuum of Care Committee meeting, live from the planet of MAG. For those around the table, please turn on your microphone when speaking. Yes, because we are around the table. We actually made it in person, and I look forward to, as we continue to meet, because I'm going to be here every single time, I look forward to seeing fewer of you on Zoom and more of you zooming around in your chairs and stuff, right? For those participating via Zoom, please state your name when making a comment or asking a question and mute when you are not speaking. The MAG public comment process allows members of the public to comment on items on today's agenda or on items that fall under MAG's jurisdiction. If you would like to comment at today's meeting, please fill out a white request to speak card located on the information table in the hallway and give it to MAG staff. That means we want to see people here in person as well so they can give comment. If you parked in the garage, parking validators are available on the information table in the hallway. If you purchase a transit ticket to come to the meeting, please see staff for a ticket. Whether you came by plane, train, or automobile, we got you. Hearing assisted devices are available for MAG staff. Before we proceed with the roll call, I would like to take a moment to recognize Wendy Johnson, who has stepped down from the Continuum of Care Committee, and Jocelyn Wilkinson, who will be moving on. She'll be stepping down after today's meeting. Everybody's looking to land well in good places. We would like to thank both of them for their service as committee members and acknowledge all of their hard work on and off of the committee. And we wish you absolutely nothing but the best in all of the work as you move forward. And we look forward to seeing your impact. And you are always welcome to be in the gallery and still make public comment. And maybe you'll decide next year that you want to apply to be on the COC again. We will now ask Haley to proceed with a roll call. Please indicate you are here and your organization after Haley calls your name.
Thank you, Chair. Don Bogart. Vanessa Carthel.
Vanessa Carthel, ABC Housing, present.
Thank you. Ashley Ziganak for Allison Cook Davis.
Hi, Ashley Ziganak with the Morrison Institute for Public Policy.
Thank you. Callie Lamers for Aaron Cowan Haig. Jessica Cruz.
Hi, good morning. Jessica Cruz with Housing Authority of Maricopa County.
Kathy Dinolfi.
Hi, Kathy Dinolfi and Lee.
DC Ernst. Nicole Gibson.
Good morning, I'm Yudi Trestles. I'm covering for Nicole Gibson today.
Thank you. Anne Marie Johnson.
Anne Marie Johnston with Community Bridges.
Christina Lopez. Marcy McFarland.
Marcy McFarland, Home Inc.
Jim McPherson. Jennifer Page.
Good morning, Jennifer Page with Mercy Care.
Gerardo Pena. Aaron Rain.
Good morning, Aaron Rain, City of Mesa.
Tyler Rosensteel. Sarah Sims.
Good morning, Sarah Sims, Phoenix Elementary School District number 1.
Laura Skotnicki.
Laura Skotnicki, the Salvation Army.
Thank you. Michelle Stokes. Jocelyn Wilkinson.
Jocelyn Wilkinson, Arizona Department of Veteran Services.
And Chair Richard Cruz.
Richard Cruz, oh, that mic was hot. Okay, mic is hot. Richard Cruz, Human Services Campus present.
Did I miss anyone? Great. Back to you, Chair Cruz.
The next agenda item is a call to the audience. This is the opportunity for the public to comment on items that fall under the Continuum of Care Committee that are not on the agenda or that are on the agenda for discussion and not for action. 15 minutes will be provided for the call to the audience agenda item unless the committee requests an exception to this limit. MAG staff, were there any comments received or anyone who has joined the call to offer comments?
There were no public comments received or members of the audience wishing to speak at this time.
Awesome. Okay, then. We'll move on to the next agenda item. We have, as a reminder, we move to a consent agenda. It is imperative that committee members read their agenda packets, read the packet, read the packet, read the packet. Reading is fundamental. It is imperative that committee members read their agenda packets prior to the meeting. Consent agendas will approve multiple items at the same time. Committee members can always ask for an agenda item to be pulled off the consent agenda to be heard during the meeting, at which time staff can provide additional information, give a presentation, or answer any questions. Do we have any questions on this before we move to approve the minutes? Hearing none. Our next item is the approval of the consent agenda. That being said, does any member of the committee have questions or comments on the consent agenda? Hearing none, can I please have a motion to approve the consent agenda?
I motion.
Laura Skodnicki moves. Is there a second?
This is Kathy. I'll second.
Kathy seconds. It has been properly moved and seconded. Is there discussion for the motion? Hearing none. For committee members in the room, we will do a voice vote. Those in favor, please say aye. Well, please say yay.
Aye.
Yes. There we go. Okay. Those opposed, please say nay. Hearing none. That's how we move. For members joining remotely, I will ask Haley to proceed with a roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
Thank you. Vanessa Carthel,
Yay.
Ashley Ziganuck for Allison Cook Davis,
Yay.
Callie Lamers for Aaron Cowan Haig,
Yay.
Jessica Cruz,
Yay.
Kathy Denolfi,
Yay.
Nicole Gibson,
Yay.
Anne Marie Johnston,
Yay.
Marcy McFarland,
Yay.
Jennifer Page,
Yay.
Gerardo Pena, Aaron Rain,
Yay.
Sarah Sims,
Yay.
Jocelyn Wilkinson.
Yay.
Did I miss anyone? The motion passes. Back to you, Chair Cruz.
Awesome. Thank you. We'll move on to our next agenda item. So for updates, the written updates were included in the packet, including a legislative update. Does anyone have any questions about the update memo or have discussions on the legislative update?
Chair Cruz, I do have a question.
Okay.
There was a sentence that was left incomplete, and I was just wondering if anyone had in the legislative update. I can pull it up. Sorry, I'll get back, but there was a sentence left incomplete, and it was relating to housing. Just wanted to get the complete sentence on that.
Did anybody else note the sentence?
Yeah, this is Jennifer. There's a sentence that starts with on housing affordability, and again on October 25th to discuss infrastructure and impact fees. So it's like the beginning of the sentence, I think, is missing. Is that what you're referring to, Vanessa?
Yes, that's exactly. Yes.
Okay.
Thank you. I appreciate the level of detail because it shows you read the packet. But that's what you do, like you read the packet. So this is good. I'm not indicating that you don't. While Haley's looking for that, were there any other comments as well or questions around the update?
Okay, thank you for your patience on that. It turns out that is a little hangover from our last packet. So my apologies on that. So you can just disregard that sentence. My apologies again.
Okay. Any other questions? No? Okay, well, we'll move to the next agenda item. That's the systems flow dashboard. Stephanie Crum is on the line. HMIS manager at Solari will provide a recap of the systems flow dashboard. Stephanie, the floor is yours.
Right. Good morning, everyone. Let me go ahead and share my screen here.
Right, is everybody able to see okay? All right, perfect. If this is the first time you're seeing this dashboard, just want to point out that there are some definitions. If you scroll down on the landing page, you'll get general definitions, definitions for who our inflow and outflow are, and then also our by name list inclusion and exclusion criteria. So let's go ahead and get into the numbers. Give me a second to load here. Whoops. All right. So as we're looking at our total numbers, moving from August to September, these are September numbers. We're seeing kind of just an overall drop in the system again of about 2%, not a huge drop here, but still trending downward. That was about a 1% drop for singles. And even though you can't really see it on this full outline so much, there was about a 10% drop here for the family systems, about 10% drop in active families, about 1% for singles, but overall that adds up to about a 2% drop system-wide. As we get down in here to our subpopulations, we'll see that most populations are continuing to experience a drop. Most of them are about 1 to 2% until we get down to the unsheltered population. And again, we're seeing a drop of about 12% here from August to September. We do see a couple rises in population. So elderly added about 2% to their population from August to September. And then also the youth added the most out of, or actually the second most out of everyone here, which was about, actually, no, it is the most, about 4%. They added 4% to their population. Let's go over on into our flow details and see where people are coming and going from. So again, you'll just see our overall average up here at the top, our overall numbers. As we scroll down into inflow and outflow detail, what we're seeing here is that this is being mostly driven by new clients. We'll see it's not a big increase, about a 2% increase, but the return from inactive is continuing to drop, especially as we see our unsheltered population drop. So they experienced about a 16% drop there. Return from housing is pretty steady. It's no change from August to September. As we get into our outflow, again, we're seeing those unknown negative drop a little bit there from July to August, but now we're seeing them, oops, this ley line is not cooperating. We're seeing them just start to tick up a little bit here, about a 4% increase in our unknown negative exits. And we do have a win here for housing from 470 to 501. So that's about a 7% increase in folks who were housed from the month of August to September. So I've been talking a lot. Let me open it up to any questions that anybody has.
Thank you. What questions do we have? What are you seeing? So, okay, here's my question for the group. What are you seeing that's correlating with this, that may be different from this? What do these numbers look like on the ground? Okay, Jessica Cruz, I see you've raised your hand.
Hi, good morning. So I know last month we had some questions regarding the outreach. I believe that there was a big drop in those that were street homeless. Now, did we ever get clarification on what that was from?
Yeah, we've been working on investigating that. We do have some sort of preliminary findings. I was going to get with MAG to discuss how we wanted to talk about that, whether we wanted to just do a quick data brief. There's still a couple things that we're going to reach out to the outreach collaborative to sort of get their take on before we make any conclusions. But we do have some idea of what was going on. We're just kind of wrapping that up, and then we'll get that out there for everybody.
Thank you.
Mm-hmm.
Awesome. Thank you, Jessica. Other questions? Okay, I haven't asked if you all are going to have that conversation. Stephanie, if you could be ready to present that information at the next meeting. So this way we can see, like, was there like some level of best practice that's been taking place that's dropping the numbers? like what's going on, or is there something we need to be aware of, something we need to be thinking about in terms of how we do the work? So, Jocelyn, go ahead. I see your hand raised.
Just out of curiosity, are we able to see if the majority of those placements were permanent housing or rapid?
For the, are you talking for the, those who were housed for the month of September?
Yes.
Yeah, I'd have to do some digging. It's not, it won't be displayed on this dashboard. That would have to be something that we would break down separately.
Okay, thank you.
Mm-hmm.
Is that something you can also bring that back to us, Stephanie?
Yeah, let me speak with MAG. We have data priorities going on right now, so I'd have to speak with them and figure out, figure out where all that fits in.
Okay. Any other questions? Okay, if no other questions, we'll move on, but definitely we want to make sure that we get those questions answered for next week. So this way we're not just looking at charts, but we're looking at, and trying to think through how do we make that actionable. Otherwise, like we're drowning in data, right? And I love data. I speak data needs sometimes, right? Like it's like not a second language, but like a 5 language for me, right? So I love the data and I honor the data and the work that you all do, but we want to make sure that we're not just looking at numbers to pontificate and have like intellectual incest about the numbers as opposed to not like moving and acting as a result of what we see. So thank you very much, Stephanie. Thank you for the hard work that you do. We'll move on to the next agenda item. So next is membership. Each year, the COC committee opens up membership recruitment in October. It was like last week. The committee opened recruitment and assembled a committee membership work group to review applications. Kathy, Laura, and myself were a part of that committee membership, and we'll now discuss the recommendation for the open seats.
Hey, good morning, everyone. This is Kathy. Haley, I don't know if there's, if I should just go back to the original document that we went through, or if there's something we can show the group. If not, just help me talk through it.
Sure. Yeah, you can either share the email that I sent to you all, whatever you're most comfortable with. You can also just like read the email. That's totally fine too.
Okay. All right. Give me 30 seconds and I'll pull it up because I just didn't know if we had it available. But I will tell you the group that Laura, Richard, and I met last week with Haley's help and went through all the applications, and we did a scoring system based on what we had previously approved for scoring. I've been a member of this group, this ad hoc group, as it comes necessary, quite a bit, at least 3 or 4 times. So I was glad to participate in again. So the list of members that we selected for membership are Patricia Scott Lopez of Arizona Complete Health, Christopher Wallace of the VA, Jennifer Page of Mercy Care, Sarah Sims, Jennifer and Sarah are on this call right now, Phoenix Elementary School District number 1, Emily Walsh of Maricopa County Health Department, and Nathan Smith of the Phoenix Rescue Mission. As far as I know, Haley, they've all been notified of their acceptance. Is that correct?
Not quite yet. We let them know after they're voted in. So,
okay. All right. Thank you so much. Sorry. Just keep reading the email, Kat.
We'll be letting them know dependent on the vote today.
Perfect. Thank you. Laura or Richard, do you have anything to add?
We wanted to make sure that we stayed within the priorities for seats that we needed, which was hospital, medical, mental health, and school and education, and first responders. We do encourage those that were not recommended in this slate to please keep in mind, we really do want to have you reapply. If you have questions on how we went through the scoring rubric, we were pretty consistent in how we scored the applications. So if you have any questions, we're free to answer any questions.
Awesome. So does anyone have any questions before I call for the motion? Okay, cool. So the committee will vote to approve the proposed members based on the recommendations from the membership work group. Can I have a motion to approve the proposed members?
Richard, as a member of that committee, I'll make the motion to approve the members.
Awesome. It has been moved by Kathy Denolfi, and I need a second.
I will second.
Hey, Jonathan.
Awesome. So it has been properly moved and seconded. Is there any discussion on the motion? If there is no discussion on the motion, then can we call for the vote, please? Okay, so we're going to do voice. Sorry, so voice vote. And so those that are in person, please indicate by saying aye. So all those in favor say aye. Aye. All those opposed, ayes have it for that portion of the vote. Now Haley will do a voice vote. I mean, she will do a call to order vote, roll call vote for those that are virtually in Zoom land.
Thank you, Chair. Vanessa Carthel.
Aye.
Ashley Ziganuck for Allison Cook Davis.
Aye.
Callie Lamers for Aaron Cowan Haig.
Aye.
Jessica Cruz.
Aye.
Kathy Denolfi.
Aye.
Nicole Gibson.
Aye.
Anne Marie Johnston.
Aye.
Marcy McFarland.
Aye.
Jennifer Page.
Abstain.
Thank you. Gerardo Pena. Aaron Rain.
Aye.
Sarah Sims.
I abstain as well. Thank you.
Thank you. Jocelyn Wilkinson.
Can I vote on this, guys, since this is my last meeting?
You're still
Yes,
on the committee.
yes, you can.
Okay. I for sure. Yeah.
Thank you. The motion passes.
Thank you. Okay. So now, let's see, we're going to jump over this next agenda item as we're waiting for the presenter. So we'll move on strategies work group update. The Move On Strategies work group has been meeting to progressively engage people in permanent supportive housing to move into public housing authority vouchers once supportive services are no longer needed. Individuals are screened and assessed for their stability. This is being done to open up more PSH units for those who are actively experiencing homelessness with higher needs. Vanessa will be providing an overview and update on the work group. Vanessa, you have the floor.
Thank you. I do have a short slideshow for you all today. So let me just share my screen. So as Chair Cruz was stating, the Move On Strategy Work Group is, our purpose is to revitalize the Move On strategy for Maricopa Continuum of Care pre-COVID. The Move On strategy where we identified members who were participating in the permanent supportive housing program, were ready, very successful in their program and ready to move on to a public housing authority voucher. And the difference between those is that, you know, when they move on to a PHA voucher, it's likely that they do not need those supportive services that the PSH program needs or provides. So we are looking to revitalize that. We had some success pre-COVID. Native American Connections had some really great success in moving on some of their participants. So we want to bring that back to our community so that we can free up more PSH vouchers for those who are currently experiencing homelessness. So today I'm just going to go over what the work group has done thus far so that the committee is aware. So our first step was to do a survey. This survey was sent to all of the PSH providers to really assess who has a move on strategy, what is that, how is that going, and what is the need. So that was sent to 11, we got 11 responses from PSH providers. This is just a few of the questions here. does your agency have a PSH program? We found that 9 do not have a move on strategy and 2 do. So we see that, there is a need and there is an interest, as you can see, that most people in question number 5 are interested in learning about move on. What does that look like? And they do see that there is a need among their participants for that strategy. You can see in number 4, 2 responded of how many they move on annually. One said 1 to 2, another said 1 to 5. And then for those who maybe don't have one but do know that there are participants ready to go forward, 2 respondents said 15, and the rest either did not know or had 0. So, I think that there is a general need out there in our continuum. I don't think it's anything going to be like 50 per year. Maybe if we got to that point, that would be wonderful. But I think as we start off, it will be a little bit smaller, but every voucher counts. And then the next thing that we have been working on is a workflow for what this will look like in our community. This is just a draft. So any feedback, I can send this out as well to get more feedback, but this has gone through our work group and in some draft and revising. We also met with each of the coordinated entry for singles and for families to get feedback on that as well. And then our next step is to go to the PHAs. So this may change, but just wanted to give the committee what foundation we're working off of. So the work group identified that we should have this in 3 phases. In the first phase, we should do identification and assessment. We want to identify participants in the PSH program for 3+ years. And then from that group, then using an assessment, which I will show on the next slide, that I'm sorry, that's the 3rd step. But the assessment looks at their stability, and we'll go over that in more detail. But we also want to look at who has steady income, who has a history of paying rent and utilities on time, so that we're not putting members who maybe have struggled recently into a PHA voucher and possibly risk, re-entering homelessness. That's the last thing that we want, right? So this assessment and identification phase is really to pull out those members who will likely be successful. And then, of course, it is a voluntary program and strategy. So if that member is interested in moving on to a PHA voucher, they can elect to do so, and then they will be assisted through this process. Phase 2 is the referral process, where we get them to the PHA. And then phase 3 is that move on, where they're really either transitioning in place, hopefully keeping their unit, which would be great, right? So they don't have to go back out into the market and look for a new place. But if they do, that's possible as well. And making sure that if they do need connection to community services, if they are aware of what's in their neighborhood, all of those kind of wraparound services that is important for housing success. We want to make sure that those are in place before the PSA provider pulls out, and then they're happily in their PHA voucher independently. Before I move on, any questions or feedback on this workflow, as it's a work in progress?
Questions?
I have questions, but I think maybe I'm hoping the next slides answer them. So I'm gonna wait till the end.
Okay.
Same here. Thank
No
you.
worries. No worries. I can come back to this slide if needed.
Itching to ask questions. Good. Hold on, Laura.
Thought it was on. Vanessa, I have a question.
Yes.
On the 3rd step, is there a possibility of a step to be in there that before they're actually terminated, that there could be some kind of advocating or part of the grievance process before going to court, being terminated and going to coordinated entry?
Yes. Yes, we can absolutely add that in. I think that was something that the work group said as well. I don't think in this version, I didn't add it yet, so I apologize. Yes, absolutely. Some type of advocating, maybe some type of the work group discussed how we could, as a work group, see if there's any wraparound services that can help address, and we can advocate for them to remain in their voucher. I think there's some logistical issues with that as far as confidentiality. And then just overall, who's tracking which of these PHA voucher holders were part of the move on strategy, and what does that look like? That's a question we're going to bring to the PHAs. But I think there's just some of those logistical issues that we still need to figure out. Also, a big thing for the work group was a safety net. If unfortunately they're not successful in their PHA voucher. So what does that look like? And we've got we've had different opinions of what that could be, but we want to make sure that there is something to help them to either avoid termination from a PHA or to have something that they can go to afterwards. So if anyone has any ideas around that, please speak up or email me. Yes.
Thank you.
You're welcome. The move on strategy assessment that's being used was used previously pre-COVID. This is based on the Connecticut Supportive Housing Assessment and Acuity Index. So the categories being assessed is housing, income and benefits, health, supportive services and resources, parenting, and child services. So it's kind of similar where it's based on a score. Based on that score, they fall into an ideal range where if the household falls into the ideal range for all three of these categories, then they would be referred as, a good candidate for the move on strategy. I do have the full version of this. If anyone is interested in seeing it, I'm happy to send that out as well.
I'm sorry, I'm gonna raise my hand next time, I promise, but I have a quick question on the assessment. Did you guys build this? Is this a tool that someone else has used that you guys are using, or was this built from scratch?
This was is based on the Connecticut Supportive Housing Assessment and Acuity Index. So I don't believe that there were any changes made to it, but that was before I was part of this work group. I know some of the people who were involved beforehand, and I can ask about that. But it seems that it was taken from this other assessment that is used.
Okay. Do we know, was there any research involved on the assessment? Like, I would just hate to see an assessment come in that's similar to the VI SPDAT, where we have the racial equity issues. I was just curious if there's research been done to, prove that it's equitable in process.
For us, for this work group, no. I don't know if that was done previously, but I can check with some of the people who were involved before. And if not, and maybe I think even it's been 2 years, I can do more research and figure that out. Thank you. That's great.
This is Laura. As I recall, it was part of the Corporation for Supportive Housing Institute, which was funded by MAG at that time, brought the assessment tool in and was a best practice at that time.
Thank you. I'll just double check, see what I can find, and see if there's other assessment tools that have been proposed. I see that there are more questions.
I can't see the hands, so if there are more questions.
Okay. Hi, it's Jessica Cruz. I will go next. So I have a recommendation, and I'm not sure if this is already something that's being worked on through the process for the referrals to the PHA, because the PHAs have a lot of additional documentation required in order to have a new admission. I'm curious if we could work on some sort of unified like application or referral requirements for our PHAs, just to also help that transition be as seamless as possible for those that are transitioning to move on.
Yeah, that would be great. And we can definitely work on that. It's probably possibly part of the assessment phase, so we don't get too far down the road for someone who may not be eligible, it sounds like.
Yep. Okay. Yeah, that would be great. And then I wanted a little bit of clarification on what Laura was asking in regard to a grievance process before the vouchers terminated. I just wanted to make sure, is that what she was asking?
Yes,
Laura.
that's exactly what I was asking. Similar to an advocate at an eviction court. So
Yep.
somebody who would help with that process to try and keep them housed.
Yeah, that would be really fantastic. So I know when we were working on Move On pre-COVID, we were transitioning some of these folks into our HCV vouchers. And so, you know, it's the way that the regulations are, and then the admin policy kind of help define how a participant is proposed termination. So I think it would be helpful, to your point, if we can identify some resources or some sort of strategy on where we would pull in this type of advocate if there is a non-compliance issue or a concern of a proposed termination being on the table.
Yeah. Thank you, Jessica. I think that's a wonderful idea. I think what we're struggling with right now is who would do that. You know, we would love, we talked about the work group doing that, maybe, you know, assisting with that, but there could be confidentiality issues, also immediacy, you know, the work group meets quarterly. So yeah, I think there's just some things to work out with that, but that's absolutely needed. Absolutely.
Yeah, and I'm curious to know how that would also relay into like fair housing, and also for the PHA side, you know, being fair across the board with the particular participants, because even though they're a Move On candidate, they are a holder of an HCV voucher, and so there's specific regulations that we have to follow. So I like the idea. I'm all for it. I'm available as well if you know, we want to strategize or maybe talk about that a little bit more in detail. But I like the idea.
Thank you so much. It's helpful to have that perspective.
Just one last thought. As part of the agency's participation in Move On strategy, could it be written into the MOU or agreement that as part of participation, that the agency who's moving the client on take on the advocacy role as part of the responsibility?
That's a great idea. I'm writing that down, Laura, so I can bring it to the work group. And the work group is mostly comprised of the PSH providers, but you know, absolutely, if anyone else is interested in participating, happy to forward along the invitation. Okay. So next steps for us is to meet with the PHAs, get feedback on the workflow, see if there's any interest in voucher commitments. And we wanted to start small. We wanted to start with a pilot of maybe 10 vouchers if that's possible, possibly with just one PHA to work it out, see, you know, get the kinks worked out, and then make sure that we're measuring how that pilot performs as far as retention, and also maybe time from referral to housed or transition in place. So those are our next steps, and anything that the committee, you know, wants us to focus on, or any suggestions that the committee has, I'm happy to include that and Yeah, thank you for giving me the time to speak with you all today.
Thank you so much, Vanessa. Are there any additional questions or comments before we move? Jocelyn, I see your hand is raised.
Yes, I'm sorry. I have
No need to apologize.
so my first question is, so the vouchers are going to be allocated from specific PHAs. Is this going to be just Phoenix? Or are you guys looking to do all of Maricopa County?
The goal is for this to be all of Maricopa County, but we wanted to start off small with a pilot and possibly just one PHA. You know, this is just kind of our ideas right now, but I'm sure, you know, we just wanted to keep it manageable so that any kinks that we find, we work them out and get that completed before we have it as like a county-wide intervention. But does that answer your question?
Yeah, it does. And so I guess my next follow-up question is, first of all, I just want to say I think this is a really great idea, but I'm always the devil's advocate for, I'm thinking about people who are on, and maybe if we have somebody, a PHA representative. So I'm thinking about people who are on the waiting list at these PHAs. Does this remove, or does this lower people on their waiting list? Like how are we going to make this fair, right? So that people aren't waiting for additional year for someone who's already permanently housed versus somebody who needs that subsidized rent. So just kind of being the devil's advocate and making sure we're including the entire scope of our housing and homeless community. Just want to make sure we're taking that into account.
I can speak to that if you'd like, Vanessa.
Yes, please. I just wanted to say thank you for that, Jocelyn.
Okay, Jocelyn. So great point. Like the perspective. Yes, in the way that the PHA sets up their administrative plan and how they prioritize waitlist, it's up to the PHA, but I can speak on behalf of HAMC. And we did build in a priority for the move on participants that are prioritized based on this particular priority. Now that does bump people down that may not have other priorities. So some of the priorities could be, you know, like a local preference, veteran preference, elderly disabled preference, and then there are special program preferences as well. So in regards to how does that meet the needs of the community for those that have been waiting, we have to keep in mind also that HUD has been proposing and rolling out additional special programs for the unique needs of our communities. So we are more recently seeing the permanent supportive housing voucher that's kind of the COC is looking at right now. With the PHAs, you're seeing the emergency housing vouchers, and that does target those that are also, you know, vulnerable or at risk of becoming homeless. So there are different ways that we are making the wait list move, where years prior, maybe the wait lists were a little bit more stagnant. Now, I can't speak for every PHA, but I can just kind of share a little bit of insight in regard to what HAMC is seeing.
And I think, you know, based on historically how many people have moved on, it's a pretty, you know, it's not a significant amount that would be really holding up, in my opinion, a wait list. But I think that's important to keep in mind that we're not overbearing, and I'm sure the PHAs would stop us anyways, overbearing in how many people we are moving on and all that good stuff. So, but that's really important to keep it at the top of our minds. Thank you, Jocelyn.
If I may, real quick, though, I also would like to add that the PHAs are also keeping in mind that it's freeing up the permanent supportive housing resource, because oftentimes we get folks at the PHAs that are homeless or maybe have not ever had their own home, and once they're stabilized, there's all these other things that are coming up, and they unfortunately do need the supportive services for housing. And in turn, you know, knowing that we're moving people on that are stabilized, that have maybe worked through a PSH program, we also are recognizing that we can now potentially refer people that didn't make it without the supportive services to a resource that, you know, we're also alleviating. So we're trying to keep that in mind as well. I hope that makes sense.
It does. Thank you. And then I just have one more comment / and I'm so sorry, guys. Like, this is my last meeting. I'm trying to get as much as I can on this. But I'm still a part of the COC, just co-chairing the racial equity portion. And this kind of falls into line with something that I wanted to pilot with rapid rehousing, which is on the exiting plan for families who are eligible for PHA vouchers to transition from rapid rehousing into a HCV voucher, in an effort to, you know, because we know that's where most of our Black and brown families are, right, or in rapid rehousing programs. So in an effort to kind of target that program and turn it in or exit them into something more permanent supportive, will, you know, address our Black and brown underserved community in housing and homelessness. So I, as the co-chair, would want to talk to somebody about how we can do this for rapid rehousing. Please let me know who I need to send my email address to, or maybe even have one of you guys attend one of the racial equity meetings to talk about how we can pilot something like this for rapid. But thank you, great information.
Thank you.
Excited to see this.
And there was, when we first started got the work group back together, we did talk about rapid rehousing, being involved in move on strategy. You know, this is a HUD supported strategy, but it's for PSH. But you know, if our community agrees that we want to include rapid rehousing clients in here, you know, I think let's talk about it. Who do we get the sign off from? So absolutely, thank you so much, Jocelyn. And I'll be attending those racial equity meetings. I see Marcy has her hands up.
And then that's going to be our last question because we have to move on the agenda. But I love it when y'all talk. This is good. This is good.
Well, I love Jocelyn's points and Jessica's points. And I'm just thinking in terms, you know, and this is from my lens of seeing progressive engagement and, you know, how phenomenal it would be to have a robust system where we have someone going into rapid rehousing. Maybe they need a little more support and a little more time. We progressively engage them into permanent supportive housing. You know, we continue those supports until they are lifted up and ready to go on to move on into something that, you know, is with less supports. So, you know, I love this idea of making our system more robust for our clientele and those we serve. So just wanted to throw that out there.
Awesome. Thank you so much. Thank you, Vanessa, for a wonderful presentation that engaged the group and set them on fire when it comes to questions, comments, and things around how we actionize and mobilize this work. I'm going to move back on the agenda one. And so Solari Crisis and Human Services has partnered with UMOM on a pilot project to improve access to resources through the 211. Ty Rosensteel, Senior Director of CSN Specialty Programs with Solari, will provide an overview of the project and next steps. Go ahead, Ty, you have the floor.
Thanks a lot, everyone. We have a quick presentation on this project, so hopefully our technology folks will be able to get that slide presentation up. Just by way of introductions, my name is Ty Rosensteel. I think you know me from the group with the work that I do with the HMIS system. Wanted to share a little bit about the work that Solari is doing in our 211 team. So we'll go to the next slide. Solari, just as an organization, again, folks know us about the role that we play in HMIS, but we also operate the crisis hotline for the state of Arizona and also Oklahoma, receiving over 20,000 calls per month of people that are in behavioral health crisis. We have a 24/7 peer support warm line, helping folks just navigate daily issues, addressing depression, addressing substance use disorders, et cetera. We also have the 211 information referral hotline, helping with health and human services referrals. And that's the program I wanted to talk a little bit about today and how we believe we're impacting homelessness in Arizona. The next slide. A couple of updates just about 211. 211 is available 24/7, 365. People in the community may be aware of funding gaps that we've had in the past. We have been fully funded with over 100 call agents responding to calls for the past 2 years. And we do have targets for sustainable funding into the future. Right now, as mentioned, 100 call agents answering over 13,000 calls each month. This is statewide. But the majority of calls, over 80%, are coming from Maricopa County and residents of Maricopa County. We have dedicated funding right now from the Maricopa County Department of Human Services to have a team that is really dedicated to housing related calls. So every person that's calling for housing to 211 gets to people that only take housing calls, and they take housing calls all day long. And that's been a really great opportunity for us to be able to have kind of deeper conversations about the realities of homelessness, the realities of our shelter system, unsheltered homelessness, and really encouraging people in this upstream opportunity to be able to retain their housing and to pursue housing options that are, typically outside of the shelter system, outside of coordinated entry. Right now, approximately 35% of our callers are explicitly seeking assistance with housing or shelter. The majority of those are seeking upstream services. They're looking for rental assistance, legal assistance. They're looking for opportunities to engage with their landlord, reconnect with family, and really stay in their housing situation. And that's where we're focused. The intervention of 211, phone-based work, it's really focused on that preventative upstream type service. Two numbers we have: approximately 60% of our callers are looking for rental assistance. 40% are identifying that they need shelter assistance, but we end up having a lot of conversations not giving a person an immediate referral to shelter. That conversation typically goes where a person will say, hey, I'm homeless and I'm seeking shelter. We ask for more information about what their situation is. And then we tell them, well, absolutely, we can tell you the location and intake process for the nearest shelter, but knowing that, in Phoenix, there are more people on the street than in shelters. The shelter beds are, full in our community. Is there another opportunity that we can brainstorm with you rather than just giving a phone number? So this dedicated team of housing calls, these calls are 20 to 30 minutes long on average, which means our teams are really spending time trying to understand what are other options. We're doing landlord advocacy a lot. So we'll say, hey, if you can go stay with your friend or go back to living with family, do you need us to pick up the phone and just provide moral support in engaging that conversation with you? We're doing about 1,000 calls like that each month of just helping people reconnect with their landlord or answer questions about rental assistance agencies. So I'll pause here just on updates about 211 and funding and kind of the services that we're providing, and just pause for any questions.
Kelly.
Hi, Ty. Thank you, Chair. I'm surprised it's only 35% of calls are about housing to 211. Can you just roughly give us an idea of what the other 65% are looking for?
Yep. So specifically housing or shelter, 35%, meaning that they're looking to retain their housing. A really big number right now. And what's driving a lot of the influx are people seeking utility assistance. So still housing related costs. So when we do kind of the full encompass of housing, shelter, utility assistance, rental assistance, we're talking closer to 50 to 60% of our calls. But that utility assistance component is a really big piece. A lot of people are also calling about crisis related work. So we're still getting plenty of people that are impacted by COVID-19 and just trying to answer questions about medical related items, vaccination related items. There's still a lot of questions that we receive in those domains. Another piece that's really interesting is that as we've continued to train our staff to identify trauma signals from callers, we've been identifying more people that are in need of crisis services. So if you look at our data over the past year, as our staff has gotten better at identifying those calls, we've actually had a lot more people transferred to our domestic violence partners as well as our crisis hotline directly.
Other questions that we have? So I have a question. If you know, so with you partnering with UMOM, is there also like, can we do that on the single side as well?
Well, I have a couple more slides.
Okay.
So
let
me share the pilot and what we're doing specifically in homelessness, and then we can talk about what opportunities for collaboration exist.
Perfect. Okay.
So if we could go to the next slide, 211, we are really striving to just be a good partner. We want to do more than just inundate shelters and the homeless system with clients. And, it's one thing to provide information and referral. It's another thing to really be a partner at the table trying to troubleshoot issues. So in working with Family Housing Hub, great partners at UMOM, we identified a couple of issues. The first is that when we have been transferring people to the Family Housing Hub, just that third bullet, we've been sending 200 referrals a month to the Family Housing Hub, 200 families seeking services. A lot of those callers were having a hard time getting through to complete their intake process, to complete the process with the coordinated entry staff. And there was a large backlog of voicemails to the Family Housing Hub. And when we were talking with the Family Housing Hub about this, UMOM identified that over 60% of their callers were not appropriate for coordinated entry services, that many of these were families that would be appropriate for them to stay in their own housing situation, be appropriate for rental assistance, and kind of going through that list of callers and going through that backlog was really burdening a lot of their staff time to be able to be properly prioritizing the work that they needed to be doing. So the question was, could we clear that backlog of voicemails, identify the clients that are appropriate for coordinated entry services, many of which had already called 211. So we were calling, many of our the callers that had called 211 back and, prioritizing them. And is there a way that we could move through a process where the majority of callers to the Family Housing Hub are getting vetted by 211, that rather than having UMOM staff having to go through that arduous process of talking to every single client, understanding their needs, really making sure that they have the ones that are vetted that are appropriate for UMOM services. So we'll do the next slide and share just some of our initial results. The Family Housing Hub and UMOM staff were willing to provide training to a number of people on the Solari team to really understand and provide triage to the coordinated entry service. Very importantly, Solari is not doing coordinated entry service. We're just acting as a triage point to make sure that the people doing coordinated entry or the clients that are appropriate for coordinated entry are going to UMOM, and those that are appropriate for just rental assistance services or some type of other engagement are not getting sent to the Family Housing Hub for coordinated entry. So it's kind of just one step up diversion, right? Making sure that people are not going when there's really not a service that's available there. So this is a very recent pilot. September and October, we successfully were able to triage 375 families. 230 were appropriate for Family Housing Hub services. And we have just the breakdown of how many were literally homeless versus at risk of homelessness. And that's just to be able to describe that Solari is triaging for the Family Housing Hub, right? That when we're sending that list of here are our prioritized clients, we can say, here are the ones that really need a call immediately because they are in a risky situation, they're in a car, they're in an unsafe place, versus others that have a risk of homelessness that is very eminent according to UMOM's criteria. But then really excitingly, approximately 40% were diverted from coordinated entry. We were able to serve them by 211 services. The largest of which were referred to rental assistance and ERAP programs. We have great connections and partnerships with the ERAP programs and can make sure we'll actually walk clients through how to complete their application. So those of us familiar with the ERAP process know that some applications are easier than others. So actually sitting down with the client and making sure that they'll complete that. We'll do callbacks to make sure that they complete those items. I had talked about that landlord engagement. That's actually really broad. It's not just landlords from like a formal sense, but family members, other people that may allow for tenancy for the caller, just engaging with them to try to troubleshoot solutions. And then 20 were specifically referred to legal aid. So if we can go to the next slide, I just have a couple of takeaways. 211, we're not the type of provider that is direct service. We aren't going to be, the place where you're having an in-depth conversation around diversion, right? We're a triage diversion spot. We're in this partnership, we're not doing VI SPDATs, we're not doing robust data entry into the HMIS system, we're not conducting intakes, but we're really just making sure that callers are not going to be frustrated, right? The clients are not going to be frustrated about calling 5 different places. It's like, we're going to triage and make sure you get to the right place. And then I believe that will increase the capacity for providers. That's the feedback that we're getting from UMOM, that they're able to spend more time on the work that they are funded and need to do to be able to handle that. The second piece is that we're handling large volumes of callers. Our answer rates exceed 90% across all of our 211 lines of business. Average speed of answer on the housing hotline is under 2.5 to 3 minutes. And then we've also seen that phone-based care creates a lot of opportunities for improved access to services for many people in this upstream model. I wouldn't claim that 211 is a great resource for a chronically homeless individual currently experiencing street homelessness, but it could be a really great resource for improving access to services for many others. So those are the takeaways for today. I just wanted to share the partnership, and I'm happy to answer any questions that you all have. I also don't know if anyone from UMOM is on our call today. I'd love to look around the room and ask them, but if there's anything that our partner would like to share, definitely open to that as well.
I work with UMOM in the rapid housing side.
Wonderful.
Yeah, I think this is fantastic. Like, I work closely with Anna, and I know that you guys have been piloting these, but I definitely feel like it's, like you said, it's going to decrease a lot of the unnecessary like extra work for the family housing hub, like to really focus on those that like are in immediate need of services and like continue to decrease the amount of time that like, the process takes. I think it's phenomenal. It's really great.
Thank you for that feedback. So open it up for questions.
So first, does anybody have any questions? I do have questions, but Katie?
Do you think it would look any different if we were not in the time of having ERA? Like, would this be as effective when we don't have all of this rental assistance dollars? I know, very hypothetical.
It's a great question. I think the reality is that for people that are upstream of homelessness, regardless of the resource that is currently available in the community, that is still what we're going to be discussing and pushing, right? Trying to find opportunities to apply for rental assistance, to find alternative mechanisms to retain housing. And so regardless of, what the availability of the resource is, I would really hesitate to tell a person that, could find rent somewhere to go to a shelter, right? Or to go to coordinated entry. And so, like I said, these phone calls that we're having with clients are really long. We're really describing the context of the situation. We're trying to help people brainstorm what the best option is for them. And, I would say even devoid of, abundant rental assistance that we have in the Valley right now, we would still be really trying to divert people away from coordinated entry and shelter whenever possible.
Thank you.
Chair, if I may ask one more question.
Yes.
Ty, I want to be sensitive in how I ask this because I don't want it to be offensive, but I know that 211 funding has come in and out of political favor in the last few years. Are we looking at sustainability here if we have this much activity and this much interest It seems like the word is really out and I would just hate to see it go away again.
Yeah, so we have commitments from multiple state departments to continue funding. So I can't speak specifically of what is there, but we have committed funding through 2024, and we have multiple state departments that really understand the role the 211 can be playing, and it's my personal goal. Like the typical model of what you hear for 211 are these 5-minute phone calls where you're giving out white page information, right? Like that is not the model of 211 that Solari believes in, and it's not what I personally believe to be effective, right? I believe the real effectiveness is around brainstorming and helping people navigate to resources and eventually closing the loop on making sure that those things happen through dedicated follow-ups, through making sure that the partnerships like what we're describing with you, Mom, can happen system-wide. So the more that we can create partnerships like this, the more that we can demonstrate that this is a valuable connection point. And that's the same thing that has happened with behavioral health over the past decade, to be able to say to have a coordinated approach to addressing behavioral health crisis. Now that's a nationwide model of having phone-based care as the first stop in addressing behavioral health. I believe that phone-based care in addressing homelessness type issues is a necessary preventative cure that needs to be in our community and broader.
Okay, so my question is, with your pilot project, right? What could this look like, or what is the openness to doing this on the single side?
Well, I think at 211 we definitely are open to partnerships that would make sense,
Yes.
and so it would really be a great opportunity for collaboration and to talk through that.
Okay.
One of the biggest pieces that I would say is really driving the conversation on the family housing hub is the coordination of shelter. So when people are talking about accessing family housing hub services over the phone, they're typically asking for shelter options for families. And so what we would do is we would describe, well, there's a couple of shelter options, but there's this one coordinated entry process that gets you access to multiple shelters that, has a community oriented list and, housing resources that would be appropriate to that. So, I think the model could be very different, right, of
Okay.
what it would look like. So, we are in 211, we're doing coordinated entry, very specific work in 4 counties throughout the state. So Graham, Greenlee, Gila, and Santa Cruz counties have very limited resources for coordinated entry work and shelter work. So 211 actually operates as an entry point for singles and families in those counties, and we'll do VI SPDATs and by name list management for those counties. But that's really driven by community need, right? Like the desire is not that 211 would come and replace these things. It's just what is the gap that phone-based work could provide support for. And in those counties, it makes perfect sense to do that because there's not geographic coverage, there's not places we can send people to, but phone-based work is helpful.
Yeah.
So I don't have what the vision would be.
Okay.
But
do.
I think it would be great to sit down and talk through it.
Yeah, let's talk through it, because I've got I see the web and how it connects and everything else, and from the family side, plus with the Welcome Center being open 24 hours a day, being able to do that. And we want to, we're looking to begin to convene a conversation at the Human Services campus around convening single adult shelter across the county. And so what that all looks like, yeah, so let's talk. Okay, so this is why we're meeting in person. And I look forward to seeing each and every one of you at the next meeting. Are there any other questions? Because we still have another presentation to go. No?
I have a question. If
Go
I,
ahead. Go ahead, Sarah.
thank you. Hey, Ty, just a clarification from someone who recommends the Family Housing Hub line numerous times a day. If what I'm hearing from you is I should actually be diverting those calls that are coming to me to 211 instead of a call and the repeated call to the Family Housing Hub?
Not yet, Sarah. So
Not yet, okay.
we're working through that process, and we want to investigate what that looks like. So we're not making that commitment yet. The phone number at the Family Housing Hub is still operational. That is the referral mechanism. But we want to be able to see if we can get to that point, that because again, answer rates on the family on our housing hotline always exceed 90%, which is great. Our wait times are always under 5 minutes, which is even better. And so if we can provide that initial triage and really make that commitment with UMOM, that is where we want to get to. We're not there yet.
Awesome.
I would say continue to refer to the Family Housing Hub. 211 staff might be calling them to triage, but we may have an update later this month to early next month of what that could look like. But I don't want to make any changes around that yet.
Thank you. Just wanted to clarify.
Thank you.
Awesome. Any other questions? Well, thank you, Ty. I appreciate the information. It was great information, actionable information, and things that we can use. Now we'll move to the Connections to Other Systems of Care work group update. Decreasing returns to homelessness was identified as part of the Maricopa Regional Continuum of Care Board Strategic Plan. In order to accomplish this goal, the Maricopa Regional Continuum of Care Committee formed a work group to identify and increase connections to other systems of care to ensure individuals and families are connected to the right care and able to maintain housing stability. Haley will now give an update to the Connections to Other Systems Care work group.
Thank you, Chair Cruz. It'll be a quick update. We only had one meeting, but it was really great. We had a small but mighty team. So our first step really is sort of brainstorming what systems of care should be included in this broader network to make sure that we're referring to the correct systems of care. And also we talked about how to effectively educate people who are also in those systems of care to educate back into our community. So definitely seeing how we can go both ways on that. So right now we are working on a big diagram of all the systems of care that are currently involved with housing and homelessness. And then from there, we're going to start identifying gaps of what we're definitely seeing is missing. So definitely more information to come, but
Awesome.
Super big thank you to everybody who attended that work group.
Awesome. Thank you, Haley. Now, thank you. Do committee members have any action or discussion for items for future meetings? Okay, well, with that being said, there were some things that were lifted up, some asks during this meeting, so that we hope to see some presentations around that in our December meeting, so that we can get that turned around. And it's really important that we make sure that we're moving faster than meetings. Like we can move with the speed of the meeting, right? So we don't want to move to a space where somebody asks the question this month, and then next month we clarify the question, and then the month after that, then we answer the clarification of the question, and then we get the presentation like 4 months later, and then it's autopsy data. And autopsy data, like the issue's already dead, but we need to be able to operate on it so that it's alive. So that being said, we'll move to the final agenda item, which is comments from the committee.
Co-chair.
Yes, Vanessa.
Sorry to interrupt. I did have a request for a future agenda item.
There we go.
I did see on the updates that the board is looking to revise the board strategic plan, and I was just wondering if once that's completed, that could be shared with the committee.
Go ahead, Haley.
Absolutely, yes, we will definitely do that.
I will say one other thing. Sorry to jump in, Haley and Chair. We will be asking for feedback from you all in your December meeting. So if you have any things that you are like burning to talk about during or put in the board strategic plan, please bring those back to us. You don't even need to wait till your December meeting. You can send us an email. But come January, February timeframe, once that's finalized, we'll bring it back to you all too.
Thank you. Are there any other comments from the committee? Any announcements that people have? Anything of that nature?
I have two announcements.
Go
Chair.
ahead, Haley.
First, I'd like to share that on November 16th, we will be having a senior work group listening session. This is really to identify, clearly we see, like, based on the numbers on our systems flow dashboard, that we're seeing a rise in senior homelessness. So we want to convene a group to just figure out, like, what are the specific needs of seniors experiencing homelessness? What are the gaps? And is there anything that a work group can do to convene and start working on? So we definitely want to get a lot of feedback. So we've had a lot of interest so far, but the more the merrier. So please, if you are able to attend that on the 16th, we would love that. Just shoot me an email and I can get you added to that event. It's also in our newsletter if you've had a chance to read it. And then my second comment is we are seeking a co-chair for the committee. So if you are interested, please just email me a statement of interest. And we can chat more about that at our December meeting. If you have any questions about that or commitment or whatever, you can go ahead and reach out to me, or I will put Richard on the spot.
Yeah.
And so you can reach out to him as well.
Reach out to me. Holla back.
And that is it. Thank you so much.
Awesome. So two things I want to lift. One, for those of you that may know, Race Forward, which is the largest conference on social justice and race in the country, is going to be in Phoenix next week. If you haven't already signed up, you can't. But there's a pre-con that's on the 17th on, like, racial equity 101, as well as building racial equity within your organization. That is free, in person, because the virtual is not. So, and that's at the Phoenix Convention Center. It's a full day situation. You can Google Race Forward so you can look at the information. I would strongly recommend anybody that's interested in creating the impact along racial equity lines to be there, because you're going to have the most brilliant minds in the country all in one place, and that synergy in that space is amazing. Secondly, just to raise this number up. So the last 2 years, there has been, like, we've been alarmed by the number of people that have died while experiencing homelessness. 2 years ago, that number was 557. Last year was about 551. And so the report came out. So we're at up to October 31st. So as of October 31st, that number for this year currently is 1,090. I just have to let it sink in. 1,090 individuals that have passed away while experiencing homelessness. And just a reminder, we were, like, alarmed by the numbers 550 and 557, like in those 550s numbers, like that was alarming to us. And we will double that number over the course of this next, this next month. So we can't just do work. We have to work to end homelessness. That's my comment. Beyond that, do we have any other comments? If not, I look forward to seeing all of you, or many of you, in the space next month. We will have a meeting next month. We don't take December off, and seeing even more of you in January and more of you in February, and us getting to a space where we're like, oh, maybe this room is inadequate because it's bursting at the seams and everybody's, like, getting around the table, because the more brilliant minds we have working on this issue, the better the work will be and the better the outcomes will be for those that we serve. I thank you very much. This meeting is adjourned.